name is Arlene. I work as a dietitian. In this video, we will talk to you about nutrition, hydration and dysphagia. We will look at practical ways to provide good nutritional care and the signs and symptoms that indicate poor nutrition, particularly in those with swallowing difficulties. The information in this video is aimed to help healthcare staff to optimise the nutritional care of people with dysphagia that they look after.
Dysphagia is the term we use to define any difficulty with eating, drinking and swallowing food or fluids. Swallowing difficulties can challenge patient safety and quality of life. An increased risk of malnutrition and dehydration are among the potential complications associated with dysphagia. Early identification and management of these can have a positive impact on the patient experience and outcome. Adults with swallowing difficulties who require a modified diet and fluids frequently fail to meet their nutrition and fluid requirements, placing them at a higher risk of malnutrition and dehydration. Malnutrition can be a consequence of dysphagia, and dysphagia can be a consequence of malnutrition. A vicious cycle of deteriorating nutrition and dysphagia can arise and require early and effective intervention. It is surprising that the numbers of older people at risk of malnutrition are so high, and yet it can often be prevented and treated. We know up to 35% of residents in care homes and 29% of adults on admission to hospital are malnourished. In those with dysphagia, the risk of malnutrition is amplified, with up to 51% of adults with swallowing difficulties identified as at risk of malnutrition, and 75% suffering from dehydration.
As healthcare staff, you are uniquely placed to notice the signs and symptoms of malnutrition. Signs to look for can include a history of recent weight loss,
any change in appetite, or eating less than half of most of their meals, or someone refusing food where they usually wouldn't.
A recent illness, for example a chest infection, urinary tract infection, or pain from a fall or a pressure area. Someone who is needing extra assistance with eating and drinking, or if you notice that someone is having difficulty swallowing their food and fluids.
If you notice any of these signs, the person you're caring for may be at risk of malnutrition. Regular nutrition screening with the Malnutrition Universal Screening Tool MUST is recommended for all service users, including patients in hospital, residents in care homes, and adults in the community. Please refer to the MUST Care Pathway for more information on screening. It is important to be aware of the barriers that impact on someone with swallowing difficulties and their ability to eat and drink. These can include fear of choking associated with eating and drinking. They may be only able to manage a small portion before they fatigue. Meals are visually unappealing and can lack flavour. There can be limited choice and variety, and they may no longer be able to have the foods they most enjoy.
What does good nutritional care look like? Mealtimes are extremely important, and it's often the highlight of someone's day. The key to getting someone to eat well is often participation and choice. They may be tired of eating the same thing every day. Food and drink preferences should be taken into account. It's important to ask about likes and dislikes. A range of foods should be offered to ensure variety and choice. Foods should be in keeping with ethnic, religious and cultural dietary needs. Be aware of any special dietary needs. For example, if they are vegetarian, have allergies or intolerances, or religious beliefs that may impact on their dietary intake.
For adults with swallowing difficulties, it is important that meals and snacks and fluids are at the appropriate texture and consistency, as outlined in the Eating, Drinking and Swallowing Care Plan provided by the speech and language therapist. It is essential that the choices are suitable for their recommended IDSI levels. Before serving meals, It is important to remember hand hygiene. Ensure the person is sitting in a safe and comfortable position with appropriate cutlery available. Meals should be served in a pleasant environment, free from distractions, noise, and unpleasant smells. They should be presented in an attractive way in terms of texture, flavour, and appearance, ensuring to keep food separate on the plate so the person can easily identify them. Mealtimes should be unhurried and encourage enough time to eat and drink safely.
What can you do to optimise mealtimes and prevent malnutrition in people with swallowing difficulties? In your role as healthcare staff, you are uniquely placed to help optimise the nutrition for people with eating, drinking and swallowing difficulties. Ensure your care plans are up to date and that you have the most recent speech and language therapy recommendations. Encourage 3 small meals and 2 to 3 snacks or nourishing drinks in between meals. Offer a glass of full cream milk with all meals. Thicken to the appropriate IDSI level if needed. Avoid low fat and reduced sugar options. Provide assistance and encouragement at mealtimes if needed. Ensure a comfortable, upright position to eat and allow adequate time to finish the meal.
There are simple foods that you can use to add additional calories and protein to boost the nutritional content of the food without increasing the quantity or size of the meal. By fortifying the diet, you can prevent weight loss and poor nutrition. Simple substitutions can significantly increase the calories and protein content of a meal. For example, adding cream, butter or cheese to savoury sauces, mashed potato or soup, or adding sugar, jam, honey or cream to porridge, custard, fruit or cereals can significantly increase the nutrition. Here are a few examples. A 30-gram portion of full-fat grated cheese can provide 110 calories. A small portion or knob of a butter, fat or spread can provide 50 calories. A tablespoon of mayonnaise can provide 100 calories. One tablespoon or 20 grams of double cream provides 90 calories. A teaspoon of chocolate spread can provide 50 calories. A teaspoon of honey or sugar can provide 20 calories. A thick spread of jam will provide 40 calories. Choose full-fat dairy products. A 200 ml glass of full cream milk can provide 140 calories, compared with 200 ml of skimmed milk, which only provides 70 calories. It is important to note that thickening milk may take longer than water or juice-based fluids. Please remember to allow 10 to 15 minutes for the drink to reach its desired level when preparing milk-based fluids. A serve of porridge prepared with skimmed milk and no toppings provides approximately 200 calories. By preparing this with full cream milk, adding 1 to 2 tablespoons of double cream and a squirt of honey, you can increase the calorie content to approximately 390 calories. Adding extra ingredients to a meal may change its consistency. Be mindful that the addition of some of these items may create a sticky or runny consistency. It is always best to check the meal is still the correct consistency to match the person's recommended IDSI level at the time the meal is served. Hydration and nourishing drinks. Clients with swallowing difficulties often require thickened fluids, which can impact on their risk of dehydration. It is recommended to aim for a minimum of 6 to 8 cups of fluid per day. To optimize nutrition and hydration at the same time, we recommend that you offer nourishing drinks. These can include pure fruit juice, full cream milk, coffee made with milk, malted drinks, milkshakes and smoothies. When thickening fluids, ensure that you follow the manufacturer's instructions to achieve the recommended IDSI level. For more information on how to prepare a thickened fluid, please see our other video entitled Thickening Drinks. Ensure all drinks provided are the IDSI level recommended for that person. Always be sure to use 200 ml when preparing a thickened drink. If a person has been found to be malnourished with MUST, or if they are newly commenced on a level 3 liquidized or a level 4 puree diet by the speech and language therapist, they will need to be referred to the dietitian. A dietitian will assess the person's nutritional needs and advise on suitable dietary changes to help meet those needs. Their nutritional care plan will aim to stabilise weight loss or promote weight gain, reduce muscle loss, optimise overall diet adequacy, optimise hydration, address barriers to good nutrition, and improve quality of life and enjoyment with eating and drinking. Some people with dysphagia will struggle to meet their needs with diet alone and will be prescribed oral nutrition supplements. These will help with meeting nutritional requirements. They are an effective way to promote a lot of nutrition in a small volume. They are prescribed and chosen to suit a client's individual needs. Please ensure to only offer what is recommended for your client. Oral nutrition supplement products may vary to suit specific needs. For example, dysphagia, fluid restriction, renal disease, wound healing, and others.
When providing someone with their prescribed nutrition supplement, please consider the following tips. They should not be used as a meal replacement. Offer them between meals. They are best served chilled. It is important to consider flavour preference. Always check if they need assistance with the packaging or if they would prefer it poured into a glass. Always ensure that the practical guidance from your speech and language therapist is adhered to when providing supplements. For example, if they require a specific cup or spoon size, or the volume is limited. It is important to ensure that the nutritional supplement is appropriate to the person's recommended IDSI level. The addition of thickener to nutrition supplements may lead to unsuitable, lumpy consistencies. This is not recommended. If someone's swallowing advice and recommendations have changed since the last time their nutrition supplements were reviewed, please speak with your dietitian to check that the current prescription is still suitable.
You play a crucial role in optimising the nutrition and hydration of those with swallowing difficulties. It is important to update, inform, and maintain your knowledge and skills to ensure safe and effective management of adults with dysphagia. If there is someone that you have concerns about not eating or drinking adequately, it is important that you report in a timely manner so that referral can be made for specialist assessment and advice. You can discuss your concerns and observations with your senior, supervisor, or your dietitian and speech and language therapist. For more information and advice on any of the topics discussed in today's video, please see the websites below. Alternatively, contact your local speech and language therapy or dietetic department.